Hello everyone, let's talk about the common infections and the diseases which we have in our daily life. The first one is the cholera. Let's see what are the causes of this cholera. Cholera is being caused by the bacterium called the Vibrio cholerae. So this is the bacteria that causes this and it spreads to various people. Let's see the various symptoms. The first one is that the severe water, diarrhea, or vomiting. The person can experience this phase as the symptoms that it could last maybe for more than a week or two. Also, the second one is the body weakness. The person may feel very weak and tired. The third one is the fast and the weak pulse, whereby the pulse becomes very fast or very weak. The other one is the low blood pressure, whereby the blood pressure drops because of this disease. The other symptoms is the wrinkled skin and the sunken eyes due to the dehydration. The dehydration is caused because of the vomiting and the diarrhea. So a person is becoming dehydrated. So if it becomes dehydrated, it means that the skin used to be wrinkled and the eyes is sunk. The other one is the rapid loss of weight because of this disease. Moving on, let's see the transmission of this disease. This disease is transmitted through various ways, such as follows. The first one is the food or waterborne material contaminated with the feces from infected person. So if a person who is healthy, who gets to be contaminated to these pieces of an infected person, he or she will contract the disease. The second one is the handling of contaminated objects that has been contaminated from the other people. And the last one are the vectors. The vectors are the agents of traveling uh, this disease. So, example, the flies that move the human feces to food. So, if a person eats that infected food, it gets to be contaminated with this disease. Let's see the prevention of this disease, cholera. The first one is washings after visiting toilets or Latin. That is should be regular for everyone else. The second one is that the food should be well cooked and the drinking water should be boiled or well filtered to stay away from the germs. The third one is hands should be washed before and after eating so as to avoid the contamination. Also, the food should be well covered so as to avoid the vectors to move the germs to a food. The other one is the utensils should be washed thoroughly so as to avoid the contamination. And the other one is we maintain general environmental cleanliness, whereby you have to maintain general environmental cleanliness so as to stay healthy. Moving on, let's see the control of this disease. The first one is that the affected person should be isolated uh, in order that he or she should not affect the others. So he should be isolated from the other healthy people. The second one is that the special precautions should be taken when handling the affected person, so as when handling him, he should not be contaminated with this disease. The third one is the vaccination. This is used to control as the infected ones to stay unaffected. Let's see the treatments. The treatments are that the disease can be treated by using antibiotics such as the tetracycline and the chloramphenicol. So these are just the few of the antibiotics that can be used. And the second one is the administering rehydration solution. So the administering of this help a person to be rehydrated. Let's see what are the effects of this disease. Before I just few of the effects, the first one may lead to death. when a person is severely sick of this disease. And the second one is that the extra medical expenses can happen to treat this disease, and lead to failure to perform various daily activities that could bring income to people. Moving on, let's see malaria. What are the causes of malaria? Malaria is caused by the Plasmodium, and the signs and symptoms are as follows: high fever. This fever can be continuously irregular or twice daily. Then there's vomiting, lack of appetite, general body weakness, and the joint pains. So this can be experienced as signs of malaria. Let's see the transmission. That the malaria is transmitted by the female Anopheles mosquito, and the mosquito basically sucks blood containing plasmodium from the infected person, and introduces them into the body of a healthy person. In such a person who is healthy gets to be infected also. Let's see the effects of this malaria. These are just few of the effects. The first one is that can cause death, can lead to mental confusion in case of cerebral malaria. Also leads to paralysis and the unconsciousness and the drowsiness, anemia, and the miscarriage. So these are just of the few effects that it could be caused of this disease. Let's see the prevention, the control of malaria. The first one is spraying insecticides. Insecticides are used to kill these mosquitoes which can be spreading the disease. The second one is draining stagnant water to remove the bleeding sites of these mosquitoes. The third one is the use of mosquito nets to prevent the mosquitoes from biting people. The other one is the spinning the windows with the mosquito-proof wire mesh to prevent the entry of mosquitoes in the house through the windows. The other one is wear long the shirts and the trousers to prevent the mosquito bites, so as you should not be contaminated or infected to this disease. And the other one is cutting bushes around the house in order to destroy shelter for the mosquitoes. This is the treatments. You can simply treat this by using the anti-malarial drugs that can be used to treat the disease, such as the quinine and the chloroquine. So those are the just of the few anti-malaria drugs that can be used. Let's move on to typhoid. Typhoid is caused by bacteria known as Salmonella typhus. Uh, Basically, the bacteria damage the internal wall and the other parts of the body, like the gallbladder, spleen, and the bone marrow. And therefore, are just few of the signs and symptoms. The first one is fever, slight abdominal pains, diarrhea, and the vomiting. Uh, it can be transmitted through the contaminated water and food, and the handling of contaminated objects, also in the vectors of the disease, such as flies. Effects: typhoid can cause death, can cause ulcers and the final rupture of the intestine, and it also can enlarge the spleen. So these are just the few of the effects of typhoid. Prevention and the control: wash your hands after visiting the toilets should be basically regular, and always the food and the water must be protected from the dust and the flies, and the wash hands before and after eating. Drink boiled water and eat properly cooked food. Also, food should be washed thoroughly before being eaten. The vaccination also can help to prevent or to control the disease. The treatment is that the disease can be treated by using antibiotics such as the tetracycline and the chlorphenicol. Tuberculosis, also known as in short as TB, it is caused by bacterium called Mycobacterium tuberculosis. The disease can attack the lungs, any part of the body, and destroy the tissues. The signs and the symptoms are the loss of weight, coughing, fever, chest pain, blood in the sputum, and the transmission are like through droplet infection, through milk, drinking milk from the infected cattle. Overcrowded areas also with the poor sanitation also can cause the transmission. Effects of this disease that it causes a number of death and it shortens and it thickens the chest in case of the TB of the spine. The prevention, the first one is that the elimination of the conditions under which TB thrives, example overcrowding, poverty level living, and the inadequate nutrition. The second is the observing general personal hygiene, especially when coughing and sneezing. The third one is the early BCG, that is the Bacillus calmette guerin vaccine. This vaccine may be used either of the two reasons. The first one is protecting the newborn babies at particular risk of the infection, and the second one is immunization of the young persons or at the risk groups in the community. The other one is keeping children in particular away from the risky situations, the use of sterilized milk and the pasteurized dairy products to avoid the contamination, and the contact tracing so that the risk to others may be minimized. The treatment are like antibiotics such as the streptomycin can be used to cure the disease. I hope it's clear, guys. Thank you for listening. We've talked about the virus, common diseases and infections, their symptoms, transmissions, effects, the ways of prevention, control, and treatment. I hope it's clear.